Welcome to our TED-Ed lesson on person-centered care. In this lesson, we'll be focusing on nursing. However, the prerequisites are often found across multiple disciplines within the healthcare profession. What is person-centered care? There is no one set definition of what person-centered care entails, and this is because of two main reasons: the adolescence of the practice and the dramatically varied practice of the care that the recipients receive. There are, however, common traits within the majority that suggest person-centered care should be affording people dignity, compassion, and respect, offering coordinated care, support, or treatment, offering personalized care, support, or treatment, supporting people to recognize and develop their own strengths and abilities to enable them to live independent and a fulfilling life. Further, the World Health Organization expands on person-centered care with people-centered care, which is defined as an approach to care that consciously adopts individuals, carers, families, and communities' perspective as participants in and beneficiaries of trusted health care systems that are organized around comprehensive needs of people rather than individual diseases and respects social preferences. People-centered care also requires the patients to have an education and support they need to make decisions and participate in their own care. The carers are able to attain maximal function within a supportive working environment. There are four main categories that make up person-centered care, which are prerequisites, the care environment, the care process, and the person-centered care outcome. However, this TED-Ed lesson will focus just on the prerequisites for being able to achieve person-centered care, which are professional competency, development of interpersonal skills, commitment to the job, clarity of beliefs, and knowing of self.
Professional competence in relation to person-centered care refers to a holistic approach which combines a health professional's abilities and judgments as developed from participation in post-registration activities. The aim of these development activities is to continually evolve competency in the following areas: knowledge, expanding an individual's education, both clinically and from a person-centered standpoint; experience, including on the job as well as social and personal experience. This might include personal values and cultural considerations. Abilities, putting your knowledge and experience together to ensure an effective clinical approach, and ability to keep the patient and their wishes at the heart of care. The Nursing and Midwifery Board of Australia has registration standards regarding continuing professional development to ensure nurses stay professionally competent. The number of CPD hours required differs depending on the area or level in which the nurses practice. These activities might include attending seminars, workshops, mandatory learning activities within the workplace, or self-directed learning relative to the nurse's role. These activities keep knowledge up to date, ensuring the practitioner remains clinically competent in the ever-changing landscape of the health industry.
A vital part of nursing care is the ability to competently and professionally communicate. It allows the health professional to glean information from their colleagues and the patient. According to the Journal of Clinical Nursing, ineffective communication still remains a potent barrier in healthcare and is influenced by wide variations in terms of quality and quantity of nurse-patient communication. If this communication is completed proficiently, it can foster a positive person-to-person relationship, allowing the nurse to gain a more involved understanding of their colleagues and the patient. Good interpersonal skills can also lead to less litigation, creation of a friendly working environment, increased staff productivity, effective time management, improvement in patient care, development of a good reputation for the institute or hospital, and a higher standard of training for employees and trainees. As a health professional, how can you properly communicate with your patients, and what interpersonal skills does this entail? Well, firstly, effective communication involves actively encouraging patients to share information by showing them empathy, honesty, and respect. By utilizing these skills, the nurse can develop a crucial bond of trust with the patient, allowing them to feel safe and comfortable within the care of the nurse. Another useful skill that helps in building this trust with the patient is responsiveness and awareness while caring for the patient. The nurse needs to know the patient's emotional and psychological states while caring for the patient, which includes balancing the wishes of the patient, such as the demand for privacy, hospital policy, and competent proactive practice. These skills all amalgamate into the fundamentals of care framework, which builds on the awareness of the emotional and psychological states of the patient. by creating the integration of care model. This is a step-by-step interpersonal process divided into 3 steps. Context of care, including the policy and the system in which the patient and nurse resides. Integration of care, which includes physical, relational, and psychosocial elements. And the conclusive relationship established step.
Leaders use their interpersonal skills to develop and nurture positive practice environments. Leadership is about relationship building, which involves empowering and influencing the attitudes, beliefs, behaviours and feelings of team members. Leaders create an inspirational workplace where people want to work and learn, and where team members' contributions are recognised. This results in team members feeling their contributions are valued and respected, in which they come to work with purpose and leave with a sense of pride. According to CRISP 2017, teams do not occur spontaneously. The attitudes and capabilities of leaders are contributing factors to an effective team. These characteristics include leading by inspiring, enabling, and motivating rather than dominating, effectively communicating strategies and processes for sharing information, clarifying the roles, responsibilities, and accountability of team members, collaborating and seeking external opinions and expertise, regularly reflecting on team progress and how this relates to team goals, taking the time to celebrate successes and to support each other when things are not going well. Leadership requires support at all levels along the healthcare spectrum. Effective formal and informal communication processes that are transparent, participation in decision-making regarding clients and organisational decision-making in respect of clinical care delivery models, promotion of a safe work environment that provides adequate education and opportunity for personal and professional development and recognition of achievements, implementation and monitoring of equitable and manageable workloads. In 2015, a research study reported on 3 Norway nursing homes, Nursing Home A, B and C, on the roles of leadership in the implementation of person-centred care using dementia care mapping over a 12-month period. 18 staff members and 7 leaders participated in focus group interviews based on the role of leadership. The interviews were based on a semi-structured interview guide. The purpose of this research study was to investigate the role of leadership in the implementation of person-centred care in nursing homes using dementia care mapping. The results showed that the roles of leadership in the 3 nursing homes were characterised as highly professional, market-orientated, or traditional. Firstly, the highly professional role of leadership found in Nursing Home A showed that leaders had a clear integrated vision of the DCM plan with a long-term focus on professional development. Nursing Home A had basic funding with no direct influence on daily practice. Leaders were consistently present on the ward, in which they communicated effectively with members of staff. The staff conveyed ideas in care practices to the leadership team, in which these ideas were heard as the leadership team encouraged staff initiatives to develop their skills in care practice. Secondly, the market-orientated form of leadership found in Nursing Home B showed that activity-based funding gave detailed instructions on care practices. The leadership team did not have a clear vision of the DCM plan. Leadership was inconsistent as leaders could not be present on the ward and had to lead through others. Due to lack of supervision, staff lacked confidence and were not motivated and did not pursue professional development. Finally, the traditional form of leadership found in Nursing Home C exhibited basic funding with no direct influence on daily practice. Leadership had no active vision knowledge. Staff members pursued professional development, but the leaders did not action PD requests as staff were encouraged to use their acquired skills. The staff members felt as though their leaders had forgotten about them.
In nursing, as in life generally, you are presented with all sorts of issues and situations to which you will react. The way you deal with problems that arise will be based on the values that you have and the moral standpoint you take. It is not easy to define exactly what constitutes a value. Perhaps your definition of a value indicates that it is something very important to you. It is personal, precious, and very often something you would take risks to defend. Nurses are responsible for their clinical function, and their main responsibility is to take care of the clients and patients who deserve appropriate and safe care. They act based on the values they have selected. These values form a framework to evaluate their activities, influencing their goals, strategies, and function. These values can be counted as a resource for nurses' conduct towards clinical competency and their confrontation with contemporary ethical concerns. Values conduct human life priorities and form the way we live. They act as one of the most basic parts of human life. Ethical values are inseparable components of society and, as a result, the nursing profession. Nursing and Midwifery Board of Australia 2010 state nurses deliver patients with a sense of support, empowerment and safety. It is wrong for a nurse to impose their own values and beliefs, as it may make them feel discriminated against, uncomfortable or unsafe. Most importantly, nurses must reflect upon their own values, beliefs, and not allow them to undermine a patient's identity. It is also important nurses reflect on their own needs, behaviours, values and attitudes and beliefs, and are conscious of their potential impact in therapeutic and professional relationships with people in their care. Nurses' awareness of their values and the effect of their values on their behaviour is a core part of a humanistic nursing care. Values originate from cultural environment, social groups, religion, lived experiences and the past, and ultimately health, education, social status and patient's care. Nurses must have a respectful attitude to the patient's needs and desires whilst understanding the requirements necessary to fulfill their religious and cultural beliefs. Jean Watson once said, "To care for someone, I must know who I am. To care for someone, I must know who the other is. To care for someone, I must be able to bridge the gap between myself and the other."
Knowing self refers to making sense of how one's history and experiences shape the way in which they view themselves and the world, and the impact this has on how they interact as healthcare professionals. To practice person-centred care successfully, McCormack and McCants suggest that practitioners should strive to make sense of his or her knowing, being and becoming as a person-centred practitioner through reflection, self-awareness and engagement with others. Facilitated self-reflection is a tool in developing self-awareness, allowing the individual to understand what drives their own behaviour. Reflection in many training programs focuses on encouraging one's ability to reflect in action and on action. The journey towards knowing self is a continuous, lifelong process of personal discovery, which can be personally confronting at times. However, it is critical in a healthcare setting, as awareness of personal values and beliefs can help them avoid interfering with being open and accepting of patients.
With the ageing population of Australia, increased expectations that are being placed on the healthcare professionals and our healthcare system, and the alarming increase of chronic diseases, the necessity for our healthcare system to adapt and come up with new innovative ideas is obvious. According to Davidson and Hickman, registered nurses make up to nearly 80% of the healthcare workforce and provide the largest amount of patient care. With this in mind, it's exciting to see the initiatives nurses are taking towards improving healthcare models, such as using link nurses, who are nurses that act as a link between patients and specialist palliative care services to improve the quality of care delivered to patients. Another exciting nurse-led innovation in healthcare is Kay Griefson's inflammatory bowel disease passport. Kay Griefson is an inflammatory bowel disease nurse specialist at the Centre of Gastroenterology at the Royal Free London. Research shows that those suffering with IBD have a greater travel-related risk of morbidity due to infections and incorrect vaccination procedures. With this research, Kay Griefson developed the IBD passport. She describes it as a dedicated, evidence-based, not-for-profit IBD travel advice website to enhance informed, safe travel. This passport has the potential to improve knowledge of travel-related issues in IBD, including awareness and increased uptake of vaccinations, travel insurance, and seeking expert advice prior to travel. It has the potential to prevent or reduce the risk of illness. Closer to home, companies like Nurse Practitioner Clinics Australia and Home Nursing Service are providing primary healthcare by teams of enrolled nurses, registered nurses and nurse practitioners to patients in their local area. They provide services including acute and chronic illness care, post-hospital discharge support, health and medical care coordination, health assessments, high-end complex health care, and nurse practitioner aged care in locations such as home, aged care facilities, retirement villages, local pharmacies, and medical practice.